It's a public health problem. It affects a large proportion of babies. It costs a lot for the economy, for the family, for the individual. It impacts the fact that a child is born early. It's a burden on its entire lifespan and health later. I'm looking not only at the child who's born prematurely, I'm looking at the mother who's impacted by that premature birth. Having a child in NICU, in newborn intensive care, is a tremendous burden. Days lost from your job, from what the family, normal family, it impacts on siblings. So if you think about the impact of prematurity and why this research is important, yes, it is. Prematurity is probably the most important determinant of infant mortality. However, because it's the tip of the iceberg, the children who die, it's the children who live, who with severe morbidity, it's the families that are impacted, it's their siblings. So it's this trickle-down effect. We, as researcher and clinicians and translational scientists, we know that our research will impact on all these members of the society. And if you think about how much each of these contributes economically to the loss of income and how the society has to really dampen the effect that prematurity itself has, then you realize as a researcher, that your work is making a huge impact. I didn't know I want to be a researcher before I knew I want to be a physician, so an obstetrician. I felt that most of the times you interact with happy patients, because most of the times it's a pleasant experience. And that's when I was really drawn to the idea of studying premature birth. And I'm originally from Romania, so when I came to the United States to do a postdoctoral fellowship, and I realized how important doing research is and really addressing the basic questions, using instruments and methods and things that we could do in the lab that then could make an impact on the patient. If you think about how a very small donation could make an impact in extending pregnancy, for example, in helping us find better ways to keep babies inside, compared to the amount of money that is required to pay for the care of those babies. I mean, the investment, the difference is tremendous. So I think ultimately we're all in the same boat. What matters to the individual, it's also what matters to the society.